Hello, my name is Dr. Kevin Henson. I'm a PGY3 with the Lake Cumberland Regional Hospital Internal Medicine Residency Program. The title of this is Mixed Bacterial Fungal Infection or COVID-19, and it's a somewhat interesting case presentation on legionella pneumophilia and aspergillosis, as this patient presented to us initially at the very beginning of the COVID-19 pandemic, in which anybody who had a bilateral pneumonia, cough, fever, chills, was presumed to have the novel coronavirus infection. So this is a 59-year-old male who is immunocompromised secondary to rheumatoid arthritis, taking methotrexate and Humira. He presented to us in transfer and was taken immediately to our COVID ICU. He had a week-long history of worsening shortness of breath, exertional dyspnea, intermittent fevers, productive cough, diarrhea. As I said, his past medical history is really only significant for rheumatoid arthritis and hypertension. However, his social history is pretty significant in the fact that he smokes 2 packs a day and has done so for the past 40 years. When he arrived to our facility, he was in impending respiratory failure. Vital signs at the time: temperature 103, pulse rate in 140s, and got as high as 210. Respirations in the 40s, blood pressure at 90/60, and a pulse ox 68% on non-rebreather. His lungs, he had coarse diminished breath sounds bilaterally. However, on the left, they were nearly absent. His laboratory data is interesting in the fact that he has all the elevated inflammatory markers that were consistent with, or what we looked at for a COVID-19 infection. He was had leukocytosis. He was lymphopenic. His sodium was 128, but his CRP was well over 190, elevated transaminases IL-6 greater than 3,000, and a D-dimer that was greater than 35. However, his COVID-19 PCR was negative. The microbiology data that we were able to gather is the beta-D glucan was positive, Legionella urinary antigen was positive, and in his sputum it grew out Aspergillus fumigatus. His imaging shows no pulmonary embolism, but does show a bilateral pneumonia, initially concerning for viral as it had bilateral ground glass opacities. He was ultimately diagnosed with legionella and aspergillosis, in which he was treated with levaquin and initially started on amphotericin, and was later switched to voriconazole. After a prolonged hospital stay, he ended up making a full recovery.